covered by that pneumonia package. But he did not have to be confined yet. Pero the option would be they would send him home with zero medicine. So I'd like to believe that there's no malice there. They just really wanted to help the child. With malice would be yung pinagkakakitaan, tapos i-up case, and then hindi naman, then kikita yung ospital, pero may cases yata na reported na hindi naman talaga ginamit yung services na yun, or there was no one who had to make use of those services. So that does happen, Your Honor.
So, okay, so the topic legitimately, captured my attention and aroused my curiosity that maybe we should pursue this deeper in another in a committee at the committee level. Ang problem ko rin dyan sa upcasing would be it would distort, di ba? It would distort our data.
Yes, Mr. President, that is correct. That is correct.
The reporting is an illness, ganito.
Yes.
Filipinos, a lot of Filipinos are
Yes.
ill with this kind of a disease or a condition, and yet that is not correct. That is not true.
It would affect our data if
Yes.
it's prevalent. I don't know how prevalent it is, so it would be good. I would support that upon referral to the proper committee that a hearing would be called. Because if I may elaborate, Madam President, one of the solutions here is the rollout of consulta, which is the outpatient. Because with that outpatient, may pambili na ng gamot yung bata, yung pamilya. So there would be less temptation, malicious or not, on the part of whoever, to upcase because may pambili ng gamot.
Yes.
Yes.
Yes, the no malice case of upcasing
Will not happen
will
anymore.
not happen
Yes,
anymore.
Your Honor. Yes, Your Honor.
This consulta is now the administrative initiative of PhilHealth.
Actually, yes, Mr. President, Madam President, it has been in the proposal of PhilHealth for at least 3 years. But under my watch, as a senior vice chairman of the Committee on Finance, in as much as I was full support for the program, they could not give me enough assurance that they are ready to roll it out. Because, sorry, Your Honor, I'm talking about the consulta. Because the consulta, as I mentioned briefly, would require that you know how many residents are in a certain area, you know how many providers, and you will give them you will divide the funding to the providers to provide for the entire healthcare need for the whole year. So it's a fairly tedious process, but I would be very happy to share in a hearing or even during briefings how this works, because both DOH and a separate group of doctors have rolled it out to test it in different areas, and it works.
Okay, yes, Madam President, the important point is we have to safeguard the funds
Of course.
of PhilHealth, that these are used properly. So if we are made aware of a practice na medyo, which is a loophole or an abuse or a misuse of the laws and the funds, then we have to take a look at it. So we can put a stop to the practice by law or by administrative action. So, pero I know that was not the topic of the speech, but the comment was made about it. We will probably pursue the subject matter at the committee level once it is referred to it properly. So I would like to end my intervention and thank and congratulate our colleague who has been setting a good example for all of us. So congratulations.
Thank you very
again,
much, Your
ma'am.
Honor.
Thank you.
Thank you, Madam President.
We thank the lady senator from Taguig, Senator Pia Cayetano, for a very comprehensive report on her global health conference that she attended. We also thank the minority leader for his interpellations. Majority Leader.
Yes, thank you, Madam President. Indeed, this is a very interesting report to this August chamber that we can study further and determine their effectiveness if implemented in the Philippine context. Madam President, I move that we refer the speech.
Before I end, I was reminded by our colleague from Cavite and Tagaytay that I must end by saying, Kansamita.
Madam President, I move that we refer the speech of the distinguished lady from Taguig and Patero, Senator Pia Cayetano, and the interpellations to the Committee on Health and Demography. I so move, Madam President.
So referred.
Thank you, Madam President.